Good afternoon and good day. This is again Dr. Joe Veltmann. We're talking about the EstroGene test, and today we're going to be looking at part 5 in our series of cumulative estrogen exposure and how to reduce breast cancer risk using genomic and physiological data. This section is going to be looking at specific areas of interest to those people that are looking at how we can modify these gene pathways and the references that have been associated with these interventions in the past. Let's look first at indole-3-carbinol or diindolylmethane. If you recall, this is the supplement that upregulates cytochrome P450-1A1. In doing so, it's going to induce the 2-hydroxylation of estradiol, and it shuts down the metabolism towards the undesirable metabolites, the 4-hydroxyestrone and the 16-alpha-hydroxyestrone. In addition, indole-3-carbinol or the diindolylmethane has been shown in culture to actually kill cancer cells. So there's a double benefit here of indole-3-carbinol and diindolylmethane in being able to upregulate a particular enzymatic pathway, but also having an effect on breast cancer tumor cells. In the case of, again, indole-3-carbinol, diindolylmethane, these are compounds that actually improve the conversion of estrone into the 2-hydroxyestrone at the expense of 4-hydroxy and the 16-alpha-hydroxy. Just to give you some overview of what indole-3-carbinol is all about, it's a potent inducer, as we said, of the hydroxylation of estradiol, and it shunts the estrogen pathway towards those metabolites that are beneficial or non-toxic, if you will, to a woman, meaning the 2-hydroxyestrone. In order for the body to metabolize indole-3-carbinol into the diindolylmethane, there are several enzymatic steps. It is the recommendation of EstroGene test personnel based on clinical research and experience that the best mode upregulator of the cytochrome P450-1A1 pathway is diindolylmethane. It's a dimer of the two indole-3-carbinol molecules, but it is, and the particular product that has been shown to have more bioavailability and efficacy relative to the indole-3-carbinol, the cytochrome P450-1A1 pathway is actually DimPro Plus. This particular product has been wrapped in lecithin. Dim is a hydrophobic type of molecule. It doesn't like water, and therefore, in order for it to get absorbed, the DimPro Plus product is wrapped in lecithin to improve its absorption and improve its bioefficacy. The DimPro Plus is available through many of the outlets, whether it's through Amazon.com or whether it's through a health food store. In the case of catechol-O-methyltransferase, COMT, and S-adenosylmethionine, remember that S-adenosylmethionine, or abbreviated SAMe, is a cofactor for this enzyme, COMT, and improves the enzymatic function of COMT when it is available. Again, what we're trying to do here is decrease the toxic forms of these estrogen metabolites, namely 4-hydroxyestrone, into its 4-methoxy estrone molecule, and COMT does that. Also, COMT does the conversion of the 2-hydroxyestrone to the 2-methoxyestrone. And just to give you another overview of this, if SAMe is again acting as a catalyst to improve the 2-methoxy and 4-methoxyestrone formation. In the case of N-acetylcysteine, most of you all know that it is a precursor to glutathione and the rate-limiting amino acid in the synthesis of glutathione in the body. And if we look at the function of N-acetylcysteine, it's helping GST create glutathione conjugates, again getting out of the 3,4-estrone quinones and making sure that they are neutralized to some degree through these conjugates. There are a series of antioxidants in addition to N-acetylcysteine that are recommended to improve the neutralization of any free radicals that are generated by the 3,4-estrone quinone. So we have indole-3-carbinol upregulating cytochrome P451A1. We have S-adenosylmethionine, SAMe, that is improving the formation of 2-methoxyestrone and the 4-methoxyestrone. And last but not least, we have N-acetylcysteine improving the conversion of the 3,4-estrone quinones into glutathione conjugates. This concludes the part 5 of our estrogen gene test, and we look forward to speaking with you for part 6.